Why do doctors use a CORT scan for stroke? When someone suddenly loses speech, feels weakness on one side, or has trouble seeing, every second counts. Doctors need to quickly find out what's happening in the brain. That's where a computed tomography scan, or CORT scan, becomes essential. It's a fast, reliable way to see inside the brain and help decide the best treatment. A CORT scan can be done in just a few minutes. Because time is critical in stroke care, this speed allows doctors to get immediate images and make quick decisions. Hospitals usually have CORT scanners available 24 hours a day, so patients can be scanned right away. This quick access is vital because the sooner a stroke is diagnosed, the better the chances of reducing brain damage. The main reason doctors use a CORT scan in stroke cases is to determine what type of stroke the patient has. There are two main kinds, ischemic and hemorrhagic. An ischemic stroke happens when a blood clot blocks blood flow to part of the brain. A hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding. Knowing which type is happening is crucial because treatments are very different. A CORT scan can quickly show if there is bleeding in the brain. If blood is present, it indicates a hemorrhagic stroke. Giving clot-busting medication to someone with bleeding could make the situation worse, so identifying bleeding early is life-saving. On the other hand, if the scan shows no bleeding, and the symptoms started within a certain time window, doctors can consider giving clot-dissolving drugs to restore blood flow. These medications can significantly improve recovery if given promptly. In addition to identifying bleeding, CORT scans help rule out other conditions that might mimic stroke symptoms. For example, tumors, infections, or other neurological issues can cause similar signs. By ruling out these possibilities, doctors can focus on the right treatment plan. There are different types of CORT scans used in stroke diagnosis. The most common is the non-contrast CORT scan, which uses X-ray images without any dye. It's fast and excellent at detecting bleeding. Sometimes, doctors may use CORT angiography, which involves injecting contrast dye to see blood flow in the brain's arteries. This helps identify blockages that could cause ischemic strokes. There's also CORT perfusion imaging, which shows how much blood is reaching different parts of the brain, helping assess the extent of damage. Recent advances include extended CORT imaging protocols that scan the heart along with the brain. This can help find blood clots in the heart that might have caused the stroke, improving diagnosis and helping prevent future strokes. These comprehensive scans can detect cardiac sources of clots much more effectively than standard methods. Using CORT scans is also practical because they are less expensive than MRI scans and are widely available in most hospitals. They can be performed quickly, even in patients who may not be able to stay still for long. This makes CORT an ideal tool in emergency situations where every minute counts. In stroke treatment, time is brain. The faster doctors can confirm what kind of stroke a patient has, the sooner they can start the right treatment. A CORT scan provides rapid, accurate information that guides life-saving decisions. It helps ensure patients get the appropriate care quickly, minimizing brain damage and improving chances for recovery. Always remember, if you or someone else shows signs of stroke, seek emergency medical help immediately. Early diagnosis and treatment can make a real difference.